Hi, my name is Dr. Naveed Akhtar from the Integrative Health Convention. I'd like to introduce you to Dr. Mike Cummings, who is Medical Director of BMAS, the British Medical Acupuncture Society, where he has been involved in developing and running courses in Western medical acupuncture, acting as an associate editor for the Medline-listed journal Acupuncture and Medicine, and representing BMAS at academic and political meetings. He has published several papers in the treatment of myofascial pain syndromes, as well as in the broader field of Western medical acupuncture. Mike is an Honorary Clinical Specialist at the Royal London Hospital for Integrative Medicine, which is part of the University of College London Hospital's NHS Foundation Trust, where he supports acupuncture services. Mike will be speaking at the Integrative Health Convention on the 11th of February 2022 at our online event about the use of acupuncture in chronic pain. I hope you'll enjoy this short video where Mike talks to us about his early career in medicine and how he got into acupuncture and how he was able to reduce his prescription of painkillers by using acupuncture for musculoskeletal pain. 11th of February 2022. We hope to see you there. Hi Mike, thanks very much for agreeing to speak at the Integrative Health Convention 2022. Can you tell a little bit about yourself to our viewers?
Sure. Yeah, I'm a Western medicine trained doctor. I trained in Leeds in the 80s, and after a couple of jobs in hospital medicine, I joined the military, the RAF, because it seemed like a good population to treat. I was interested in sports medicine, so it seemed like a good idea. And then, to my great surprise, on virtually my first day, within my first week of being in uniform, I found somebody doing acupuncture. And so that's how my journey in acupuncture started, as an accident in the military, basically.
And you've been doing acupuncture ever since?
Yeah, so that was the late 80s. So what's that? That's 30 years now. I didn't do it straight away. No, I had to wait a year or two until I could send myself off on a course. And I came to the course that I now have been helping to run for the last 25, maybe. And yeah, I never expected to get sort of, I suppose, sidelined full time into acupuncture. I always thought it was a really good technique, really useful, but I would probably do musculoskeletal medicine and, try and carve out a sort of, because that was my interest area mainly when I was younger and fitter. I used to have plenty of injuries myself, and that was an obvious area of interest. But the acupuncture world sort of it was great. I mean, the BMAS, as you know, the British Medical Acupuncture Society, is it's a nice, friendly organization. In those days, it was full of some stranger sort of characters, naturally, because acupuncture tended to attract. You needed to be attracted to it, and I was only there by accident, so they were a little bit different to me, most of them, and they noticed me and thought, okay, we're going to have him and put him in the front somewhere because he looks vaguely sensible. And I guess that, so before I realized, I was sort of drawn more and more into the world of acupuncture. And of course, it's a fascinating world. It wasn't one I expected to get involved in, but look at me now, so many years later, I'm learning Mandarin and I'm knocking about with all sorts of complementary and integrative types. And it has opened my perspective. I was very much I was brought up in the normal Western medical system, which is a bit narrow. It's a little bit reductionist, and so I've had my scope forced open just by living in that world, and that's a good thing. I hate to think what I'd have ended up being like if I hadn't had that chance experience, I guess.
And of course, that's the BMAS course that I attended a good number of years ago, and that's where I learned my acupuncture.
Oh yes, of course. And was I on that then? I probably was, wasn't I? Because you're younger.
You were teaching, yeah. You were teaching on that course that I learned a good number of years ago now, and I've been.
You know what? Sometimes now I have doctors coming to me going, "Oh, Mike, I'd like you to teach my daughter now. She's or whatever, qualified in medicine. I'm going to send her on the course, and I think, oh my word, I just need another generation. I'll definitely be past it.
Can you tell the viewers a little bit about the talk that you're going to be presenting at the convention in February 2022?
Yeah, so I'm going to I'm going to be talking about acupuncture in pain because, well, chronic pain, because that's the topic that's, I guess, most interesting to us in the last year, since we've had a positive recommendation from NICE in the chronic pain guideline. So everybody's been interested in that. It's caused quite a lot of controversy in the bigger world of medicine, because it wasn't long ago that we had the unfortunate update of the low back pain guidelines, which originally had been positive to recommend acupuncture in 2009, and then in 2016 announced that acupuncture doesn't work and we're not recommending it. And that was a big shock for the acupuncture world. And now that the chronic pain guidelines have recommended acupuncture, albeit in specific settings, and limit some degree of limitation, of course, to it, because of costs, presumably, then quite a lot of the orthodox viewers of that guideline were then puzzled, thinking, well, hang on a minute, how can you say it doesn't work for back pain and now it does work for chronic pain? And so that has created quite a lot of confusion. So I'm going to try to explain why that has happened and where that's come from, without going too in depth into the nitty gritty of all the research, because it can be, it is a little bit esoteric the way the statistics are used. But I've had to get involved in that, and I've read in detail every guideline that's come out since they started looking at acupuncture, which is back 15 or more years ago, and looking at the results that have come out and thinking, how did you come up with that result? And then looking at why that was. And so I'll try and explain why there's that difference between back pain and chronic pain in the guidelines. I'm pleased that it's in the guidelines now, but it's sort of, it's only just in there. And these things can easily turn around depending on the methodology that the guideline developers use. So I'm going to do that. I'm going to give a bit of an overview of the approach that we take in the Western approach, and also try and put it in perspective with the bigger world of acupuncture and the East Asian approach, and how the two sit together. I've got a few slides I've been working on there that try to give that sort of perspective, and also a bibliographic perspective. Acupuncture has a lot of research, or at least a lot of publications anyway, to give an idea of where it sits compared to some other similar types of intervention, both in orthodox and integrative medicine. And then at the end, I'll just, for those people interested, I'll tell them how they can train and who we train in the Western approach, which is really worthwhile using, as you know yourself, really useful tool for general practitioners, and increasingly lots of other health professionals are starting to use it. I guess physios mostly done by physios, I suppose. They're the biggest number, but most of us in healthcare, there's usually a niche where we can use a technique or two.
Well, as someone who's been using it for some time, I'm a huge advocate. I've seen a number of patients that I've seen in my 10-minute consultations who've had, musculoskeletal pain or a bit of neck pain, and whack a couple of needles in them, and actually they walk out a lot better without the need to go down the route of medication and anti-inflammatories that have the potential for side effects.
Yes, in fact, that's the biggest thing that happened to me way back when I started using it in the military. Suddenly I stopped prescribing non-steroidals. I think probably a few of my patients stopped coming to see me as well, because my reputation preceded me. Yeah, in fact, when I was leaving, they gave me this little bust of myself carved out of wood with a big 6-inch nail in the back of it, and I think they said, another one for luck, doc, or something. So, but yeah, in terms of prescribing, it made a huge difference in that. To be fair, in that population, which was a young a young male population without chronic disease. So, not necessarily going to be exactly the same in every general practice, but still, when I left and went into NHS general practice as a locum, I still took my needles and I still managed to use them 2 or 3 times in every session that I did around. In those days, it was around Cornwall and Devon as I was traveling around. So really, really useful. But I have struggled to encourage GPs. I mean, you're exceptional, and in that you've done that. Not many of the GPs I've trained have managed to do it in the 10-minute consultation. And as you know, it's eminently possible. And we do always mention that's something they can do. But there are horses for courses. But hopefully, back in the day, I was hoping I would be training every GP, to have some needles in their top pocket to use. But it hasn't quite worked out that way.
Well, I mean, COVID hit and things slowed down, but when we were doing face-to-face appointments on a daily basis, I was using my needles almost every single day, at least for one problem or another. And I, personal experience, I found them incredibly helpful. And like I said, and like you've experienced, the amount of painkillers that you need to prescribe actually goes down quite significantly. So I think it's something that every GP, every medical professional would benefit from learning.
Yeah, I thank you. I agree. We just haven't been able to nail down that in the highest quality research. We've tried, looking at prescribing. It's very, very difficult to look at those changes in an unbiased way. But certainly, I've heard that a lot from GPs saying that they've reduced prescribing, and audits of practice in primary care have certainly suggested there's the vast decrease both in referrals and in prescribing in certain areas.
Well, I, for one, I'm very excited to hear your talk at the convention, and I know many of my colleagues are also excited to hear your talk. So thank you very much for your time today, and we look forward to seeing you at the convention in February 2022.
Okay, thank you for having me. It's a pleasure.
If you like this video, then please give us a thumbs up, and don't forget to hit the subscribe button so you can keep up to date with the latest videos and interviews from all the speakers who will be joining us at the online Integrative Health Convention 2022, going live on the 11th of February. Take a look at the exciting speaker lineup by clicking the link below to book your ticket now. Look forward to seeing you there.